And now the news. Government has established a firm structure to affect behavior and lifestyle change among residents in order to reduce non-communicable diseases or NCDs in the BVI. Non-communicable diseases, mainly lung and heart diseases, cancers, and diabetes, are dubbed lifestyle diseases and are the #1 killers in the world. The structure to implement the strategy to reduce the growing numbers of non-communicable diseases in the BVI was outlined at a conference on Tuesday, the 17th of May. In her presentation, Petrona Davies, the Permanent Secretary in the Ministry of Health and Social Development, asserted that a national response is needed to reduce chronic diseases.
People under the age of 60, in other words, in the prime of their lives, we are losing and burying our loved ones at a very rapid and increasingly rapid rate. And many of those deaths could have been prevented. Then we know that because we're losing so many of our people in the prime of their lives, it's having an economic impact and stagnating the growth, particularly among developing countries. And because the threat is so far-reaching and the implications are so far-reaching, we accept that the health sector cannot address it alone. So we must all come together and work effectively if we are to succeed in reversing the threat that NCDs pose to our families, our community, and our economy.
Davies said government developed its 10-year national strategy for the prevention of NCDs after a 2009 research showed that 75% of BVI's population was either overweight or obese. She said costs associated with NCDs can place a heavy financial burden on individuals and government.
So, there we have it. Less than a quarter of the population was not overweight. 75% was either overweight. This is overweight. And this is what? Obese. That is alarming by any measure. For the individual, we know that the effects can be debilitating. Renal failure, the Premier mentioned, or high rate of persons on dialysis in the territory. Blindness, we know somebody in each of these categories. Amputees, persons having heart attacks, strokes, and ultimately leading to premature death and disability. But beyond that, we know that NCDs drive millions of people into poverty every year, and poverty affects all of us. It means higher spending in terms of social programs, but also it places a burden on the healthcare system, the health financing system. We mentioned that it reduces productivity of the workforce and therefore stagnates the entire economy.
The mobilization of the national response, according to Davies, requires addressing 4 common risk factors in our lifestyle that cause persons to be at risk for NCDs.
So the 4 leading risk factors that have been identified are tobacco use and exposure to secondhand smoke. And you know we've made some strides in tobacco control in the territory, and we still have some ways to go. Harmful use of alcohol, binge drinking we call it. It's a curse of the Caribbean. Every corner is a rum shop, right? Unhealthy diet, I don't have to elaborate on that, and lack of physical activities. If we can address those 4 things, then we could reverse the trends that we're seeing.
Leading the charge to reduce NCDs is the BVI Health and Wellness Advisory Council, which oversees the Interdepartmental Technical Working Group consisting of 6 subcommittees. Now, these committees are responsible for alcohol and tobacco, physical activity, physical literacy, healthy schools, healthy spaces and places, chronic care, and health, safety, and wellness in workplaces. And each of the committee presented their achievements so far, as well as their plan of action going forward to promote behavioral change in the BVI with the goal to reduce chronic non-communicable diseases.